in this video, I want to share with you the difference between a retail pharmacist and a hospital pharmacist. Hi guys, welcome back to Farmers. How are you guys doing? I hope you're excellent. Make sure to like this video and subscribe to the channel if you're not yet subscribed, and let's get straight into this video. So many of you will know that retail and hospital pharmacists are the two most common types of pharmacists. You do get a lot of others, but those are the main ones. And so maybe their differences may be a little bit ambiguous to you if you're not familiar, and I'm here to separate the two roles for you and clarify the matter. In retail, you have a shop type of situation, right? So there's tills, there's a counter. Usually it's divided into two parts. You have the OTC and the prescription. So that's where, as a normal layperson, member of the community, you would come in maybe with a question, a query, a health issue, or a prescription to the pharmacy in order to see a pharmacist and ask some further questions regarding your therapy or just a script, right? Usually the setting is more less intense in terms of it's not an acute situation. You're not half dying. You know, your illness is minor or it's stable, and you can afford to walk around. You can afford to come in yourself, or maybe you've sent somebody and you're at home resting or recovering, and things are a little bit more chilled. In a hospital setting, however, things may be a little bit more critical. You may be hospitalized and needing more intensive care and therapy. Usually hospitals, depending on their level, in South Africa, there's primary, secondary, and tertiary levels. You will have more or less departments, depending. So let's say, for example, a tertiary hospital, for example, Steve Biko Academic in Pretoria, where I was working a long time ago, we had 6 departments of pharmacy. There you have a little bit of a retail section, which is outpatients. That's where you deal with people who come in with prescriptions or come in for their refills, kind of like what you would get in a retail pharmacy. But then you have inpatient. So that's where you get prescriptions directly from the wards of patients that are currently laying in hospital, you know, in the wards, hospitalized somewhere. Then you also get sections like store, which deal with procurement, ordering stock. You know, they do the Section 21s if there's any prescriptions that need medicines that are not registered in the country. They pull the strings. Stores is the place where you will deal with all the suppliers, all the providers, the distributors in the country, outside the country. These people pull strings for days, okay? So you have stores pharmacists that do the orders, do the procurement, do the sourcing of the medication. Then you have schedules. We had schedules /HIV. So we used to do our ARVs there and our Schedule 6s, 6s and 7s, I think. Patients that were on specific drugs used to get them from there. So we would prepare the stuff, follow up with the patients, you know, and in some cases administer their therapies. Then we also had oncology, which is dealing with cancer patients. We would do premixes or chemo mixes for them, check the prescriptions, monitor therapy, administer the chemo, and just overall manage that patient's therapy or chemotherapy. And then we had, which one am I missing? Inpatients, outpatient stores, schedules, ARVs, oncology. Oh, and then we had manufacturing. So we did small scale manufacturing or compounding in the hospital. This was usually for prescriptions that dealt with patients that were either hospitalized or even discharged but needed special prescriptions. I remember we would always have to adjust pediatric dosages, for example, for TB. So if a patient is too young for a normal dosage, we would have to manufacture it ourselves, you know, crush tablets, titrate solutions and whatever you have. We would do some creams, lotions. We would do solutions, some suspensions. So it was a full-on manufacturing clean room that we had. A little compounding pharmacy within the hospital. And that was pretty cool, by the way. So yeah, these are all the sections you would get. Typically, you would also get ward pharmacists that actually go around the wards, checking with the prescribing crew on ward rounds, you know, suggesting and modifying or tailoring some of the prescriptions, some of the therapies, etc., etc. So basically, when you're a pharmacist working in a hospital, you still have to subdivide it into which sector. But typically, a hospital pharmacist is like more of a clinical pharmacist because they deal with prescriptions of patients that are in the wards, in hospital, and that are there for usually short-ish duration. So a hospitalized patient will usually be in hospital anywhere from 0 to 5 days, 7 days max. So they monitor a lot of the antimicrobial therapies because sometimes a doctor will come on day 1, see this patient, determine that they're critical, pump them with antimicrobials, then come day 2, see that there's been a turn in events, this patient is recovering beautifully, they might want to cancel certain antimicrobials or change the therapy. Or the worst part is if the first prescriber goes, maybe he was on night duty or whatever, and then the daytime or another doctor comes to prescribe and he kind of changes things up. It's up to the pharmacist to actually realize that no, you can't stop this. You have to let it run for 3 days, or you have to titrate this dose, or you have to reduce that dose, and then discharge the patient. So the pharmacist's role in a hospital setting is really critical when it comes to monitoring therapy, pharmacotherapy. And this is why we need to develop a lot more pharmacologists that are specialized for ward rounds or ward pharmacy and clinical pharmacists. I spoke of pharmacokineticists, and this is an excellent place for them to be when they do become available in the country. So yeah, basically that's the role of a hospital pharmacist. Then you do get hospitals that have a retail section that you could just walk in, buy some like paracetamol, some cough syrups or whatever. And that is pretty much the same as you would in a retail pharmacy. I hope this clears up some of the misconceptions or confusion. I usually get a lot of questions asking what the different types of pharmacists are and what they do. So if you enjoy this video, let me know in the comments below. I will do one for different sectors. There's regulatory pharmacists, there's quality assurance pharmacists, there's production pharmacists, there's academic pharmacists, there's warehousing pharmacists, there's imports, exports pharmacists, there's a whole lot of type of pharmacists, okay? So you guys let me know if you want more detail, like videos explaining what each type is. Let me know in the comments below and I will oblige. Thanks for watching, guys. See you soon. Bye.